Okay, and we are live.
Hey everyone, welcome back to another session. Today we have Dr. Landon. He's in Hawaii and he's a general dentist. So thank you so much for coming, and whenever you're ready, you can start.
Cool. What's up, everybody? I'm Dr. Landon Oka, and I'll be sharing a quick presentation with you guys today. So this is me. I'm a private practice general dentist, Indiana University class of 2019. So this is kind of what we're going to be generally going over, super quick. So education. So I went to Oregon State University class of 2015. I got a degree in biomedical science, and I finished up dental school in 2019. So deciding factors for me for dental school, I kind of just casted a broad net. So I did West Coast, Midwest, and then East Coast, just trying to hit certain schools where I had a feeling that I'd get in, or I had a better chance of getting into with my resume and all that. Scholarships, as far as OSU, I had a few scholarships for college, and then for dental school, I didn't really get any scholarships. So those are actually a little bit harder to come by. I got picked for one scholarship while I was in school, and it wasn't too much, but that's all right. Residency programs, I didn't really do a residency program. I kind of had a feeling that I wanted to go into general practitioner anyways. So I thought about doing a GPR or AGD residency program, which is the general practice residency, but I decided not to, and I decided to go straight into practice. So my experience at IU. So the bottom middle picture is my pretty much like 80% of my dental school class. We had like a cool little house gathering. We went from like one person's house to another person's house to another person's house. Called it the house crawl, but it was super cool. We all got along really well. Everybody was super nice. You know, I went into dental school with this assumption that it was going to be really, really competitive, but my class was, I don't know if it was an exception, but it was actually really fun to be in the class that I was with. You know, everybody got along really well. Everybody was trying to help each other out. So it was actually a really fun class. South Dakota mission trip. So on the right-hand side is a picture from the Rosebud Reservation out in South Dakota. So I was able to do a dental mission trip out there. So we went out for a week during spring break to do free dental work on the reservation to anybody that would come out there. That was super awesome. You know, we got to get to know the community a little better, understand some of the cultural things. So it's honestly a really awesome experience. And then something more near and dear to my heart is this student outreach center. So IU has the student outreach center or clinic, whatever, but it's a completely student-run organization. So we helped out with people with no insurance, so no medical, no dental insurance. It's a multidisciplinary thing. So the picture on the left there is me and all the dental people. So bunch of D2s, 3s, and 4s, and then a couple hygiene students. But the SOC also has social work, law, med, farm, kind of every professional program. So it was actually really awesome, super cool to be a part of. And that was one of the things that when I interviewed there and they told me about it, that was one of the big draws for me because I wanted to have opportunity to give back to the community as well. So my specialty, it's not necessarily a specialty, I guess, but so I'm a general dentist. What I do is mostly like fillings, crowns, bridges, you know, implant restorations, extractions, root canals, cleanings, pretty much just the bread and butter dentistry there. So I did not specialize. I mentioned that earlier, but I'm still kind of considering potentially going back for endodontics, so root canals and stuff, but I'm more leaning towards staying as a general dentist just because I enjoy the relationship with the patients a lot better. You get to know them more, and you know, you really become almost like family to them, especially out here in Hawaii. We kind of value that relationship a lot, a lot more than some other places would. So I thought that was really cool, and I really liked that aspect, and that was kind of my original draw to dentistry in the first place. So that's that. So tips for school. So kind of just some study tips. because dental school and, pre-med, pre-dental undergrad programs can be pretty tough. So what worked for me was just figuring out how I learn, how I retain things. So for me, it was a lot of manual stuff. So writing things, drawing things, rewriting my notes, writing down important things. It got to the point where in anatomy, I would actually draw out every little part of everything. So if you need to do it, figure it out, figure out what works best for you. And then developing a routine. So making sure you have enough time to study, work out, exercise, and, hang out with your friends and enjoy life, because school is not meant to be like a prison. You got to put aside that time where you can enjoy yourself, because you're going to be in dental school for like 4 years. So you don't want to get into a funk and then it affects your school and studying and all that. And then the final point there is getting into study groups with people that you know. Being in study groups, it helps to see things from other perspectives. So, it gives you a better opportunity to understand things. And, what I found was like, I had probably 4 or 5 guys that I was studying with. We all kind of had our own way of studying and stuff. And, if somebody didn't understand something, we'd try to break it down for them and see if that helps. And just, having that group of guys to study with kind of keeps you from, getting alone with your thoughts and like getting distracted. They kind of keep you in the study mode while you're there. So that was one of the things that I found to be really helpful for me. Let's see what's next. So my practice. So the main office that I practice out of is in Mililani on Oahu. So the reason why I came back home to practice is, I'm from here. I wanted to be closer to home. And, I wanted my family and friends to be able to see me pretty easily and not have to go too far. And where my practice is, I saw a lot of potential for growth and, more opportunity for patients. And, it's with my uncle. So that's kind of nice too. So I actually do both corporate and private practice. So private practice is the main one. I do corporate 2 days a week. So there are some pros and cons to each one. So private practice, I kind of get to do things by myself and how I want to do them. The corporate is a little bit more restricted on that, mostly because the patients that get seen by corporate, because we do take a lot of different insurances. Patients can't necessarily pay for the ideal treatment you want to do. So you got to kind of do things a little more on the fly. But that's actually nice. Corporate's nice because you don't have to make your own schedule and all that, and they do that for you. But yeah, so I think there's a pro and con for each one. But I tend to lean more toward the private practice aspect. I think that's a lot nicer, and it allows me a little more room to give my patients the ideal care. So important factors to look out for when applying for and accepting jobs. So I highly recommend, before signing any contract, you look it over and you read it pretty thoroughly. A lot of people will look it over with lawyers and stuff just to make sure there's no funky business going on with the contract. It also helps to shadow in the practice first, just to see how things run. You don't want to go to a place that's super, super fast paced and they expect you to jump in and produce the same way that they do. And then on the flip side, you don't want to go to some place that's super, super slow. I mean, unless you're kind of into that slow stuff, but you want to make sure it's a practice that matches your style and matches how you are as a practitioner as well. And then also you kind of want to have a feel for the reputation of the practice as well. If you start off at a place with kind of a shaky reputation, that doesn't necessarily set you up for success. Because what can happen sometimes is you do absorb the reputation because you work at the office. So it's just something to be careful of. So that's kind of my factors there. Let's see. So private practice, like I said, a little bit slower pace there. So I do have access to better material. Pretty much if I want to order something, I just have our assistants put in the order for it, which is pretty nice. So CAD CAM technology, so computer aided design and computer aided milling. We do in-office crowns there. So same appointment crowns, no more impressions and like waiting around for 2 weeks. We get it right then and there. Usually I schedule it for a 2-hour appointment, which is pretty nice because the patient gets pretty good service for what it is. But with private practice, you are responsible for a lot more things. So, keeping track of your business, making sure that your licenses and everything are paid, making sure that your insurance contracts are signed and renewed and everything. So a little bit different than the other side. And then the reputation of you is based on how you are as a practitioner, like how you talk to your patients, how you do your treatments, how you interact with other people. It really weighs heavily on you. And then the schedule usually depends on you as well. So, if you're advertising, if you're out there on Instagram, if people really like you and they recommend you to their friends, so that really depends on you. On the bottom pictures of, on the left-hand side is a picture of the Omnicam from CEREC. So that's what we use in the office to scan our preps and stuff. And then in the bottom middle is a CEREC mill. So that mills out our crowns and whatever. And then on the bottom right is a system called the XNav. So I may be starting in an office soon with the XNav. So XNav is basically just a guided implant placement system. Super, super cool stuff. Let's see. So corporate. So corporate is a little bit faster paced, higher patient volume. So in my private practice, I'll typically see anywhere from 8 to 10 patients a day. Corporate, I'll see anywhere from around 10 to 15, maybe even 20 some days, because we do count hygiene checks as seeing a patient as well. So higher patient volume for sure. The reputation of the office is based more on the company name. So I work at a corporate office called Gentle Dental, and that office is found all throughout the United States. So people will come in from other states, especially from the military, and they'll say, oh, I was going to this one, I liked it there, and not necessarily be picking where they're going for their dentist based on the fact that you're there. They're picking it more because they know the name. So with corporate, it is harder to get the newer technology because they have their formulary. They have to run the numbers on whether it's going to be beneficial to the practice and everything. So harder to get the materials as well because, like I mentioned, the formulary is where you get your stuff from, and it's never going to be quite what you want ideally, but that's all right. We make it work. And then they fill your schedule with patients of record. They do a lot of the recruiting for you, so you're not out there having to advertise yourself. They're advertising for you. And sometimes the reputation with patients is not always great because dentists are in and out of corporate offices pretty frequently. So people feel like they're not attached to a provider per se. So it's something to consider when you're thinking about working corporate as well. So we'll go over some common dental terms real quick. So our main teeth are the molars. So molars are the back ones. You guys all know that. Incisors are the front ones. Premolars are our bicuspids. Canines are the pointy ones. And then the wisdom teeth are third molars. Sometimes there's like little extra teeth. We call those supernumerary teeth. And depending on where they are, they get a numbering system. Types of restorative materials. So amalgam, there's a meme of that on the bottom left there. So amalgam is a silver filling material. Composite is tooth color. Glass ionomer is another tooth color, but that one is a little bit weaker than composite. There's gold, zirconia. Zirconia is a type of metal. Looks like a tooth color, but it is a type of metal. Ceramic, and then there's a whole bunch of other stuff. Common tooth terms. I'll kind of be using these later in my case presentations, but real quick. So buccal is cheek side from the Greek word, I think it's bucco, which means cheek. Facial is usually in reference to the front teeth, and that is on the side toward the face. Palatal, of course, is to the palate. Lingual is toward the tongue. So palatal and lingual are kind of used interchangeably. I misspelled the next one, so it should be occlusal, not occlucal. That's my fault. But occlusal is a chewing surface, so where the teeth occlude together. It's where you're able to chew on posterior teeth only, so it's the flat tabletop surface. Incisal is the cutting edge of the anterior teeth only. Mesial is closer to the front of the face, or closer to, if you're the doctor and you're looking at the patient, closer to you. distal is away from you, apical is towards the apex of the root, so the tip of the root, gingival is toward the gums, and interproximal means between the teeth. So this is my first case here. This is a quick one. So case number 1, so patient's a 21-year-old female. Nothing surprising jumped out on the medical history, so that's all good. She had some generalized decay, and she used to not take very good care of her teeth. So as you can see, the cavities got pretty big. So the diagnosis here was primary caries on tooth number 29. So 29 is bottom right, second premolar, and 30 is the bottom right, first molar. So number 30, you can see it has occlusal and buccal caries or decay. The picture on the top is the tooth already prepped out, cavities are removed, and they're ready to fill. So these teeth are restored in the bottom. So when I restore teeth, I really try to make them look and function like they're back to normal. So I utilize a technique called biomimetics, which is mimicking biology with your bonding technique and your materials. So it's more than just making a tooth look nice. You're actually focusing on, improving your bond strength, making sure that the material is functioning with the tooth rather than just slapping something and making it look pretty. Let's see. So that's the final product. We got nice contours there. I could have polished a little bit better on that buccal side, the cheek side, but that's okay. We can polish that later. But yeah, I think this one turned out really good. I didn't really have to do too much adjusting afterwards. So that was cool. This is case number 2. So this is where it gets kind of cool. So a lot of you, if you guys have had experience assisting in an office, or, you talk to your parents about their teeth, you talk about caps or crowns. So my prep design for a crown is a lot different than a lot of other people. Something that I've kind of learned through my CE courses and stuff after graduating. But so this case is a 65-year-old female. Again, nothing too surprising on the med history. She had great hygiene. You can tell from her other teeth. It's just that one tooth right there has got the broken down filling, and it's just no good. So she had a large filling restoration there. She had a lot of damage under there because some decay started under the old filling. So the tooth is pretty compromised. There's a fracture line on the front side of it, and signs of some pretty heavy wear. Because it's 65 years, the tooth's been in service for a long time. So we decided on full cuspal coverage, so a crown, or what I do is called an overlay. So it's being restored indirectly, which means we're going to prep the tooth and then create the restoration outside of the mouth. So this case, we did a CEREC overlay. So next slide here. So this slide shows what the prep looks like. The prep tooth is kind of this nice, smooth, flowing prep form. And, it's pretty non-retentive looking. So we're going to really rely on our adhesion there. Let's see. So this is what it looks like up close. I think that one looks okay. So this is kind of the process. So the far left picture is, after you prep it, you scan the tooth. The scan tooth in this picture, I kind of just borrowed that from the internet. I forgot to take a picture, but the one in the middle is a picture I took of the crown being milled out. And then the far right is the final crown that's ready to be cemented. So this is all done within a matter of like half an hour. So here we are, we're isolated again. So if you're wondering what the green thing is over these teeth, it's called a rubber dam. It's used to isolate teeth, keep saliva off, and really provide an ideal environment, safer for the patient because nothing's flying to the back of their throat. They don't have to worry about swallowing stuff. And then when we go to bond-in restorations like these, they're done under isolation, so less contaminants equals better bonding. So, yep. So on the right side is our final restoration. I think I blew it up in the next picture. No? Nope. Yeah, so this is where we started on the left and then how we finished on the right. So pretty good result. And I think it matches the other teeth pretty well. Okay, so this is case number 3 here. So this patient was in his mid-60s, no real medical problems. I think he may have had high blood pressure, but that doesn't affect what we're doing too much. So my assessment of the tooth, there's a fracture line going down the middle. We're looking at the molar here with the big silver filling. So there's a fracture line that goes right down the middle of the tooth through that silver filling. and all the way to the other side. We'll see it in another picture coming up here, but you can kind of see the fracture line going through that filling too. So this filling was huge. It took up like 60% of the tooth. You guys will see it in the next slide, I think. So the tooth behind it there is crowned with a porcelain tooth to metal crown. Had a root canal done before. Crown's not great. It's pretty ugly, but we'll see what happens after. So the treatment staging for this one, so I did the exam, cleaning, x-rays and all that, and then he is in to get his crown. So we did our local anesthesia. Sorry, these are getting a little bit more descriptive, but local anesthesia. So we did the numbing with something called Articaine 4%. I like Articaine. It's got smaller molecule size, so it works a little faster. And then the rubber dam clamp is placed on tooth number 2, so our top right, furthest back molar. And here's slide 2. So slide 2, I already took down the cusp. I took out the old filling. And if you look closely right down the middle, you see this faint white line, and that's where the fracture from the old filling went all the way down through the tooth. So you can see it if you look closer to the mesial side, so toward the front, toward the premolars. There's a little divot there from where I did some crack dissection, so I disrupted the crack. And I did on the back side some margin elevation to make everything flow a little better. Let's see. So this is what it looks like. You can see that nice white line going right down the middle. And yeah, it's just not like the most ideal situation. So we did some immediate dentin sealing with flowable composite, scanned it with the CEREC OmniCam, and then we milled it. And so when we fire the crown gets up to like 800 degrees, and it goes from a purple color to a tooth color. So it's super cool. If you look in this picture, the tooth number 2 is no longer in the dam. The crown actually ended up flying off because it wasn't bonded on very well. So it ended up on the table next to me while I was doing this. So this tooth is ready to be cemented, get the crown on, and I think that's what we do next. Yeah. So the white stuff over the tooth in front, that's called Teflon tape. So plumber's tape, it's non-stick, it's really easy to mold, and it sticks to the teeth pretty well while you're working. It prevents the cement that we use from adhering and sticking these teeth together, so that's super awesome. There's a little string between the teeth called superfloss, and that's just to block cement from going down in the gums. So if you look at the top picture, that's our squish. So we're cementing this crown in with heated restorative composite. And then it's with that, we're able to clear away the excess a lot easier, blend our margin with the tooth, and then really polish it down nicely. Let's see if I have a picture of that. Yeah, so you can see a nice smooth margin that's going to be really easy for this guy to clean. And I didn't cement the crown yet, but after I cemented this and took off the dam, we went and cemented his back crown on again. Yeah, so, old stuff tends to fall apart when it's over like 20 years, but that doesn't mean you can't replace it. Okay. So that's pretty much it for my presentation. So my parting thoughts here is, committing to going into the dental field is a really big decision, financially, time-wise, because it does take 3 to 4 years, depending on what school you go to. And it is hard work. I'm not going to lie. It was not easy. It was pretty difficult, learning to balance proper studying for like didactic courses along with, putting aside time to do the lab work required for dental school as well. There are days where I would go into school at 6 o'clock to study in the library, start class at 8, and then, I stay until maybe 8 o'clock working on lab work and hand skill stuff, and then study the rest of the night after that. So, it does take a lot of time. It's not cheap, but yeah, you really do have to be dedicated to the field if it is what you want to do. Not something you want to go into if you're going to feel like you're going to get cold feet and back out or want to quit. So I'll share a quick story. My mentor, when I was trying to go to dental school, my family dentist, his goal while I was shadowing and assisting him was to make me not want to become a dentist. And he said if he could convince me to not do it, that's probably the best thing he could ever do. because it would save me a lot of years and a lot of money. And, fortunately, he wasn't able to convince me not to do it. And he said, if you still want to do it, then that's awesome. You're going to be great. So something I really recommend is, making sure that this is something you want to do. But yeah, so this is a unique field because it really doesn't matter what major you are. You can be a business major. I've had, friends that were in business school. I've had friends that were in like service industry school. I've had friends that were commercial pilots, friends that were in dental sales. A lot of people from a lot of different backgrounds. I had one classmate that was even a nurse before she went to dental school. So, it doesn't matter what major you are. It doesn't matter where you went to school. One of my really good friends in dental school went to Center College in the middle of nowhere out in, where is it, Kentucky? So, yeah, I mean, it really doesn't matter. And it doesn't matter how old you are. So my friend that was a commercial pilot, he was 40 years old when we started. And I was 21. So I was the youngest guy. He was the oldest guy. Super cool guy. But yeah, doesn't matter. Our average entering age for our D1 class was, I think, 26 years old. So a lot of people, it's not their first time applying. So don't feel like you're a failure if you don't get in the first time. Don't get discouraged. Focus on, improving your application, improving your resume, and you'll get in. And then once you get in, it's more of a matter of, how you take school, how you utilize the opportunity. So dentistry is an awesome profession. Awesome profession in the medical field. You get to work with your hands, you get to talk to patients, you get to form these relationships. So there's a lot of variety packed into just this one career. And, it's one of the few professions that you actually get to put a smile on someone's face. You actually get to make a huge difference in their life potentially. And, I see it kind of almost on a daily basis. Like, you get somebody out of pain and you turn their whole life around. So it's awesome. If you want to do it, go for it. Just make sure like you're in, because it's quite a ride. Yeah, I think that's it. Yes.
Thank you so much. That was perfect. We do have questions from our Instagram and the YouTube chat. Okay, so let's start with dental school. So can you kind of tell us like D1, D2, D3, D4, like how your school kind of progressed and what was like the main factors for each year?
Yeah. So at IU, they have you start with a summer session. A lot of schools have a summer session. So it starts around July. So we started, I think, the week after 4th of July. But we started with head and neck anatomy, and I think they had us take an ethics course. So, they started us off kind of slow. Anatomy was pretty tough, but it was actually a lot of fun. My undergrad, I was lucky enough to work with cadavers in college, but in dental school, you're doing like the full head and neck dissection, identifying, structures, nerves, blood vessels, and stuff. So it's super fun, great learning tool. So D1 year, you kind of start off in the summer. You get some exposure to clinic, not a lot. It's mostly, classroom stuff, learning about teeth, learning the numbers, anatomy of the teeth, and just like the real basic stuff. Second year is pretty much everybody's hardest year. It's like half didactics and then half lab courses. So a lot more time demanding. When I was in school, they had the 2-part board system. So the national board, part 1 and part 2. So actually kind of in the middle of your second year, you take your part 1 of boards. I think now it's the integrated board. So it's just one exam at the end of the 4th year. And so second year was really stressful. There's a lot of information to learn. They really throw more science courses at you, and then you learn all about like specialty programs and stuff too. So that one is probably the toughest one because they're trying to get you ready to be like in the clinic practicing the next year. So third year was a little bit more laid back, still some classrooms, but for the most part, you're up in clinic. And then fourth year was super, super chill, laid back. the only stressful part of fourth year was, making sure you had enough requirements to graduate, which, for most people is like the stressful thing in dental school is, finding the people that need crowns, people that need dentures and blah, 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 just so you can graduate. And then, finding your boards patients, that's kind of the biggest one. So there's a lot of talk about moving toward non-patient board exams. So if they do that, then that takes a lot of stress off in your fourth year. And then you can focus on, applying for your residencies and getting in, or, focusing on finding a job after dental school. But yeah, so I mean, it gets easier. It starts off medium, then it goes to hard, then it goes back to medium, and then it goes to easy. So yeah, it's definitely doable.
Yeah. So how did I guess comparing undergrad and then dental school, how did your study habits change, or what was like the most prominent difference?
I don't think the method really changed too much. I think the quantity that I studied increased a lot more. So undergrad, I would spend some time each week to study, but for the most part, I'd go to class and take notes, and then right before the exam, like a couple of days before the exam, I'd start studying, and that was usually good enough to get A's and stuff. Dental school, I tried that the first couple of times. It didn't work out so great. Instead of getting A's, I was getting like B's, maybe like a C plus, which like I was like, oh my gosh, like I never got that in my life. And I think that's the shocking thing for a lot of people is they go from like, it's funny because the people that apply to dental school, they're not dumb. Like they're usually going to have a pretty good GPA. A lot of them are like 4.0 students in high school and college, and dental schools where they get their first like B or C. So it's pretty shocking. But then you find out like, they're going to ask you a lot tougher questions. They're going to make you think a lot more. So you got to change up how you study. Just, for me, it was just making sure I went through the material enough times to really get it ingrained in my memory. So, I mean, it's helpful because a lot of the questions they ask you, you're going to need to know when you're practicing too.
Yeah. So, and did anyone like quit in your grade, or like did anyone kind of, or is that normal, or is that like?
We didn't have people quit. We had two of my classmates when we started D1 year. Two of them failed, so they failed out of the whole program. So they weren't invited back for to even repeat the grade. We had 5 people that didn't pass the class, but they were able to join the class below us. And then one guy was just, I don't know what his deal was. He just kind of, I think the stress got to him, but he was asked to leave the school. So
oh gosh,
we lost about 8 or 9 people in the first couple of years, but it happens, and that's one of those things like it's not a profession that's meant for everybody, and it sucks that they're still like weeding out students in the program, but in a few years they're going to be working on people. They're going to be potentially causing harm to a person, so it's kind of on the school to make sure that they're putting out competent people.
Right. So you said that you didn't kind of feel that competitive environment that you expected, and it was that because was your curriculum pass or fail, or was it like graded?
I mean, everything's pass fail if you're not trying to specialize. But
that's true.
I think it was graded, and you got your class rank and everything. But for the most part, the people that were at the top, aside from maybe a select couple, the people that were at the top of the class were like, they were super down to earth, super nice guys, and they're actually like really wanting to make sure like that people that they liked and people that were in the class did well. Like they didn't like to see people doing badly in class and struggling and stressing out. So it was nice because they would post their study guides. They would send stuff out. We have like a big class group me chat, and they'll post like study tips and stuff, or stuff that help them remember things. And yeah, it's actually really cool to have that kind of environment with other students. I know not every class is like that, but yeah, I don't know what it was. We were just a really close class. It was super cool. Yeah.
That's nice. And so you were close with like your class, but how was the dynamic between like D1s and 2s and like everyone else in the school?
I think each class kind of had their own dynamic, and it was kind of based on the majority of their students. So like, our class would get along with pretty much everybody. We were like the fun class, I think. So people would always want to like go to our events, and they're like, "Oh, what are you guys doing next?" So like we were like the fun class, and we're also the really hardworking class. So we had a pretty good rep with like the faculty and the teachers at our school. So that was really cool. But I know some classes, like if you do end up going to dental school and you take the ethics course, you're going to learn about the IU class of, I think it was like 2010 or 2008 or something. But there was a huge cheating scandal, so they got like a really bad rep. So I can imagine that the relationship between classes there wasn't too great.
Yeah.
But for the most part, when you make friends with the like D3s and 4s when you're D1 or 2, is like most of the nice guys are going to want to help you out. And like I made friends with a lot of the upperclassmen too, and they would do stuff like, "Oh, you're going to be in my clinic like group when you're in clinic, so I'm going to have you see this patient. I want you to see this patient. Like I want you to help them out, and I know you're going to do good." So just having that dynamic is also really nice too. It's like having like a big brother or sister.
Yeah. Cool. Okay, so manual dexterity is like a big part of at least pre-dental students. Everyone's stressing to do something that kind of trains your hand skills. How was that? How was your transition? Did you find it difficult? What did you do to kind of, I guess, learn?
So I got kind of lucky growing up here because I did a lot of fishing, and fishing requires a lot of fine-tune manual dexterity to work with really small stuff. So that helped. And then, I mentioned before I had my mentor also, and he just so happened to have saved his old model teeth, and he would have me in between patients, like, practice making a tooth out of wax, or have me cut a fake tooth, like cut a prep on a fake tooth and do a filling on it. So I think before getting to school, just finding an opportunity like that would really help. I know it's not like super easy to do. You can't just like walk in somewhere and be like, "Hey, teach me how to do this." I mean, I guess you could. Some people are really nice, never know. But I think looking for opportunities like that would really help. And then when you're in school, developing those further. So, spending more time in the lab if you have to, finding instructions from your TAs and your professors and stuff will really help as well. And then something that also will help a lot is, working in a mirror, like practicing that indirect vision. Because if you can do it before you go to dental school, then, oh man, you're going to be in good shape.
Yeah.
Because, the mirror stuff is also going to help with your PAT, the PAT portion of the DAT, and just being able to recognize things spatially before you start working upside down in a mirror in somebody's mouth is actually really good to develop beforehand.
Yeah. Gotcha. Okay. Speaking of the DAT, how did you study for that? How long did you study, if you remember? Was it like something that came easy to you, or did you have to work harder?
So I would not necessarily recommend studying how I studied. I only studied for like a month. If I could do it over again, I'd probably take a little bit more time. And the way I studied wasn't great either. I would go to work. So I worked as a dental assistant while I was in college. So I would go to work in between patients, and over lunch I would study, which didn't end up netting that much study time in that month. And I don't know what it was. I think I was just being lazy. But I would definitely, take some time to study, take some time off to really focus on it, break it down. while you're in school. If you have a pre-dental program, see what the other people are doing, see what they're up to. They might put together like a study group or something. They might have some study resources that they're done using and you can borrow from them.
Yeah.
So I had, I think, the Kaplan DAT prep book, and then my dentist, he bought me a practice test as like my birthday present. So that was cool. So that's how I studied. It ended up working out. I mean, now I'm here, so something went right. But yeah, I would definitely check the forums and stuff to see what people are up to, see what some really popular questions are, and just really get a good foundation of information to take your exam on.
Right. So you mentioned your mentor, and he seems like such an awesome person. So how did I guess you approach him, or was there already like a connection versus like just shadowing someone? So how do you kind of find a mentor versus just shadowing and like building that connection?
So he is our family dentist. So like, we went to him when we were kids and stuff, but I mean, when I was in high school, like I just randomly had this thought, like, I want to be a dentist. I'm going to ask him if I can shadow and see what this whole field's all about. And if you find somebody that's passionate about the work and about the career, like 9 times out of 10, they're going to be more than willing to like teach you everything they know and, really help you along in your journey to becoming a dentist too. And like, I know a lot of doctors out here too, like they're more than willing to share their knowledge, to, share their space and share their experiences with any pre-dental student. So I think the biggest thing is to just ask and kind of let them know, like, I think it'd be really cool if I could like get a little more insight if you're willing, and more than likely they're going to be like super down to share everything they know.
Yeah. So he told you, well, he wanted you not to quit, but to show you the bad side of dentistry, so you would like find out early, right? So was there a reason, like, was that just so that he would save you from like all the work, or is it because he actually didn't like dentistry?
No, so he loves it, but he knows that it's dealing with people can be pretty stressful.
Yeah.
Not everybody's going to be in a good mood. Not everybody's going to be happy. People are going to come to us in pain, and they're going to be frustrated because, sometimes they're going to go see other people, and the other dentist isn't necessarily going to be taking the greatest care of them. So, he wanted me to see all that stuff and realize, like, that's what we're dealing with on a daily basis, not just, oh, here, I fixed your whole smile. Look how happy you are, like the commercials make it seem like. And he wanted me to see what the field really was about, and not just what TV shows or commercials play it off as. So, he wanted me to see the harder side of it, not necessarily the bad side, but the things that make the profession more challenging.
Gotcha. Okay, so you mentioned you were a dental assistant. So were you certified, or did you like just get on-site training, or how would a student kind of go about that?
So in the state of Hawaii, you don't have to be certified to become an assistant. So I got trained on the job. So I learned how to do x-rays. I learned how to take impressions. And then I also learned how to make the temporary / provisional crowns and stuff. So that was like all on the job training. But as an assistant, I also had to fix our vacuum a few times. I learned how to be an electrician and change out light fixtures and rewire them. So super cool stuff.
Setting you up for multiple careers.
Yeah. It's just he had a really small practice. My mom's best friend was his front office / assistant / insurance, like everything for the office. She was like the one person that does it all. And so when I was there, like she would get a break from assisting and stuff. And he wanted to show me, like, if you want to have your own place, sometimes you're going to have to, it costs money to fix things. So sometimes you got to see if you can do it yourself first.
Yeah.
So that was super cool. But yeah, I think some offices, like if you shadow and you tell them, hey, I want to work here as an assistant, they'll bring you on as an assistant. And
Mm-hmm.
nothing is better than being chair side and actually seeing how tough things are sometimes.
Yeah. Okay, so did you take a gap year or did you go straight into dental school?
So I almost had to take a gap year, but I didn't. I went straight high school, college, dental school. So I got done in
Mm-hmm.
8 years straight, graduated at 25. But
Wow.
now I think about it, I mean, I wouldn't have minded taking on a gap year. It's not the end of the world. And actually, it's kind of nice to have a little bit of time to kind of settle in between the two, because you go from, your college is super fun, and you get to hang out with your friends, and then you go into this program where you're around the same, well, depending on your class size. My class size was 112, so you're around the same 112 people every single day of the week. And you're in a more stressful environment, you're working harder, and you're under a lot more pressure. So sometimes that gap year helps a lot.
Yeah.
One of my friends from college took 3 years of gap years. So we were the same graduating class at Oregon State, and he ended up at IU with me when I was a when I was a third year.
Oh,
So
wow.
he texted me. He's like, "Hey man, I'm interviewing at your school." And I was a second year, so I was like, "Oh, dude, are you in the interview room now? I'm gonna drop by and like."
That's crazy.
Yeah, so it's super cool, but yeah, I mean, I think everybody's got their own path, and you kind of got to just feel where you're at. Sometimes going straight from college to dental school isn't necessarily the best thing. A lot of people feel burnout. They feel like they've been working too hard, at too high of a level for too long, and they burn out, they get stressed out, and it's not the greatest thing for your mental health if that's how it's going.
Of course. Okay, so what were your top factors when deciding dental schools?
My top factors were, I looked through what their prereqs were, first of all. So number one qualifier for me applying there was, would I get in with what I have right now? So that was number one. That's pretty important to know too, is like what prereqs there are, because there are some programs that want you to take like anatomy and physiology, some programs that don't want you to, or don't need you to. So like knowing the prereqs also helps. I wanted somewhere where I could have a lot of community service experience, which IU was awesome. I think Stony Brook also has like a student outreach clinic or something like that. But yeah, somewhere where I can, really give back to the surrounding community. And then I wanted also somewhere that had, a reputation of putting out good students. And I think IU's kind of like middle of the pack there, but what I realized when I went to school is what it all comes down to is what you make of the experience, not necessarily what they're teaching you. Because for the most part, dental schools are going to be teaching you the same stuff. There's a couple of schools that might teach you some more advanced things, like maybe USC or UW, but for the most part, it's all the same stuff and same basic stuff. It's going to be more of like, are you talking to your clinic faculty? Are you talking to your tooth morphology or your single tooth or indirect, like professors and stuff? Are you talking to them and like picking their brain and seeing like what their advice is for you as a future practitioner and stuff? And I think what was cool for me is like IU had a history of having people from Hawaii go there. So a lot of the faculty were like, "Oh, you're from Hawaii? I know so-and-so from there." And they're awesome guys. So like, I'd be like, "Oh, cool." And then I find out more about the faculty. I'm like, "Oh, let me like pick your brain. Let me ask you like, how is your practice management stuff? What would you do in this situation?" I'll show them a picture like, "Oh, what do you think of this prep? Or what do you think of this tooth? What would you do over here?" And like, if they're at the school, they want to work with students and they love talking to students and they want to help you. and that's why they're there. So I think a lot of people get caught up in, just trying to do their requirements, that they forget, like, these faculty, like, they really like students. They want to get to know you and they want to help you out to get to a better future. So
Gotcha.
pretty much every school is going to have that. They're going to have awesome faculty, and you just got to reach out. Yeah.
Okay, so you mentioned, I guess, how the school is known. So how would you say, like, let's say you get into a prestige school, of course, debt is a huge part of that, but how heavy do you think that should weigh in your consideration for dental school?
It should weigh a decent amount. It shouldn't, like, completely discourage you.
Mm-hmm.
But if you're having to pick between two schools and they have, kind of a similar reputation, maybe you're picking between somewhere like USC or IU, because that's kind of what my choices came down to, is like USC or IU. And USC, they charge, I think it's like $110,000 a year, and IU for out of state was like $85,000 a year.
Mm-hmm.
So that was huge. And then I also kind of looked at, like, the surrounding community too. And USC is not in, like, the greatest neighborhood, and IU is in an okay spot. So, that was good. But yeah, I mean, you got to think financially, like, how it's going to affect how you live, where you live, like, what you do, how you practice. Because when you take on like $400,000 of debt, some people are in like almost $500,000, because you got to factor in cost of living too. It does affect you for the next like 10 to 20 years, what you're doing and how you're living too.
Of course.
It should actually be a pretty decent factor. If you have choices, do think about the finances part too.
Yeah. So I don't know if you feel comfortable sharing this, but how hard, I guess just in general, after dental school, seeing that debt and then kind of weighing how much you need to work, how does that kind of affect your work-life balance and your stress and just...
So it's funny, because it's always this like cloud that's kind of over your head. Like, you know it's there and you want to do something about it, but you can only do so much at a time. I know a lot of people, it pushes them to be a lot more aggressive with their treatment planning, and things that are kind of on the fence of being like, if you can do a filling or if you should just put a crown. Like, I know some people will over treat and stuff and just consider like, oh, I got to get this loan paid. But, I try not to. I actually really don't want that to affect how I treat my patients. So, I mean, as much as it sucks, I kind of just, as I try to stick to my, what is it called? Like my practice philosophy of like, do what's right, and do right by the patient, do good by the patient, and, only do what you have to do.
Yeah.
So there are days where I'm like, oh man, like I could definitely like, I could say like this tiny thing is cavity, but I really wouldn't sit well with me, so I don't do it.
Of course. That's awesome. Okay, let me go to the YouTube. Oh, someone's a really big fan of yours in the YouTube chat. They're asking, where are the good fishing spots?
Good fishing spots. I'm assuming out here. So I would say anywhere on the North Shore or East Side, West Side, South Side's not the greatest.
Okay. Okay, so you kind of mentioned the dental assistant experience. So someone asked, would becoming a dental assistant be a good way to get experience? So I guess you can just kind of describe how that put you ahead when you were in dental school, what aspects were better than others who weren't maybe dental assistants.
So dental assisting actually, like, it gets you documented hours that you're in the practice too. So that's a super easy way to keep track of your hours. And, now like with COVID stuff, like, they don't necessarily want just someone hanging out in the office and, an extra body in there. So if you're an assistant, then you have a reason to be there. You get to see procedures up close, up front. You can be there to see like the different angles, how the doctor uses their instruments differently. and then you kind of understand what each instrument is used for, and then the application of each different kind of treatment. So that's super, super cool. Good information to know. And then also if there's like live patient boards, you can make some money in dental school too. So I assisted for boards like pretty much every year, because they're like, oh, you were an assistant, like come help me out. Like the upperclassmen will always want, they'd prefer students instead of paying someone like $500.
Oh, they have to pay you?
Well, it's preferred, yeah.
I mean, like from your pocket?
Yeah.
Oh, wow.
So my friends, like, I mean, it's a little excessive, but it's like, you help them pass their licensing exam, but I've gotten paid like a few $100 for like one day, and that's super nice. Yeah. But you're also there from like 6 a.m. to like 5 p.m. Yeah. So it's a long day, and you do help them a lot. And so just having that background of an assistant, you can kind of sit back and really be helpful and useful to them. And when you're assisting for the boards, like you get to see the inside of the board exam. You get to see like, how the examiners are, like what the requirements are. Yeah. And I think for me, that was super valuable. So when I took my boards, I knew how the flow was going to be. I knew what they were looking for in the like cavities and stuff. And then like, I knew like, I didn't necessarily need like the most experienced assistant. I just needed someone there that was like chill. So I got my friend Marcus. So when I was a fourth year, we were allowed to have third year assistants. I was like, Marcus, you're like the most chilled, laid back person I know. Like you assist me, and he's like, oh yeah, dude. And it's just good to have someone there to like, settle you down if you're getting worked up, to be like, hey man, you're doing good. I like, have him look at it, and he's like, looks good, dude, looks good. You're gonna be fine.
So support.
Yeah. So assisting experience actually sets you up for a lot of good opportunity when you're in school.
Mm-hmm. Gotcha. Okay, so someone asked, would you recommend any other isolation system, or do you prefer only the rubber dam?
I prefer the rubber dam. You can use like iso dry or iso vac, and it's all right, but it's like not everybody can really tolerate that either. I find rubber dam is a lot better, just because it also pushes the gums down a little bit too. So if you're working on a really deep spot in the tooth, you get more straight line like visual access to the area. Whereas sometimes with iso dry and stuff, like if the gums are in the way, you're kind of just like, putting your handpiece there and praying for the best almost. So, I like it because you can really visualize what you're doing. It also keeps, so in the gingival sulcus, so around the tooth and the gums, there's a lot of fluid there, and, it just comes up naturally, and the rubber dam helps to isolate and keep that out. And when you're doing a composite filling, the drier you can keep it, the better. And I haven't had better results with anything besides a rubber dam. So kind of my go-to. Yeah.
Gotcha. Okay. So how hard was finding a job right out of dental school? And then also, because you didn't do a residency, how was kind of like the transition between it?
I wouldn't say it was hard. Being from here and, having a lot of friends here really helped me. So I had a few opportunities on the table, and I don't know why I went with whatever was safest for me, but yeah, I mean, I got job offers, just like I didn't even do a formal interview. Wow. They would just be like, oh, hey, I'm looking for a guy to work here. Here's my office. This is what it looks like. This is what we do. Do you want to work here? I'm like, oh, let me think about it. But I think when I was first starting off, I was a lot slower, because you go from, having 3 hours for a patient to like maybe an hour and a half. And like, in that lull between graduating from dental school and then getting your dental license is like, there can be a pretty large time gap. So I graduated in May. I didn't get my license until August. and then I didn't do my first prep so I got it late August. I didn't do my first prep until September. So that's a pretty long gap. But I think, for me, once I got in my groove, I got a lot faster really quickly. And then, figuring out the rubber dam also just helps so much, keeping the cheek and the tongue out of the way. That really helps with the speed too. And then, yeah. So I know the GPR programs helped a lot of people. I just didn't think that was like the greatest fit for me per se, because I just wanted to go home, to be honest.
Yeah, gotcha. Okay, we have time for one more question. So you said you might specialize, but would you consider, I guess, opening your own practice and specializing, or like, is that something financially you have to pick one?
Out here, I think you do kind of have to pick one, just because the cost of living in Hawaii is really high. Cost of real estate is really high. So you kind of do have to pick one or the other. And there's no dental school out here, so that doesn't help.
Yeah.
If I was anywhere else, I would try to see if I could own, or at least be like a co-owner or partner or something while I'm in a program. But yeah, I think that'd be the most ideal way to do it, just because, you'll have that income and you won't be going into that much more debt going to your specialty program.
Right.
Most specialties do also pay you while you're in school. So I know ortho, they pay you like $40,000 a year to cover like living expenses and all that. And so, I mean, there's a benefit to each side, but I think for me, if I were to go back, I would have to just pick one. Yeah.
Gotcha. Okay. Thank you so much for the wonderful question and answer session, and then your presentation. You can put up your Instagram if you'd like.
Oh, so. Yeah.
But yeah, that's all we have for today. Thank you again for joining us. And yeah, that's it.
Yeah, no problem. And, everybody can just feel free to just DM me on Instagram with any questions too. Like, I'm more than happy to answer any questions there. I pretty much respond to everybody as soon as I can. So yeah, feel free. Yeah. Don't hesitate. It's a open line.